Hi everyone, my name is Sarah Schrup and I am a research student at University of California, San Francisco, where I work with Dr. Michael Alvarado in the Breast Care Center there. So today I will be presenting a single institution evaluation of local recurrence rates following intraoperative radiation therapy for breast cancer. And all data presented here today was collected at University of California, San Francisco. So intraoperative radiation therapy offers a simplified delivery of radiation treatment to breast cancer patients during surgery and has been shown to be non-inferior to traditional external beam radiation for select patients. Today we'll present post-surgery follow-up data collected from patients who underwent IORT. We will also evaluate risk of local recurrence associated with demographics, disease characteristics, and receipt of external beam radiation therapy. So the UCSF patients included in this cohort received IORT either as part of a randomized Target A trial or the single-arm Target US trial. So the cohort we're presenting today included a total of 101 patients with at least 3 years of follow-up data. The cohort consisted of patients aged 45 years or older with small tumors less than 3.5 centimeters that were ER positive and HER2 negative upon clinical evaluation. And all accrued patients received a single dose of IORT, 20 gray, by the Zeiss Intrabeam device immediately following tumor excision. And patients who had received delayed IORT as part of the Target A trial were not included in this cohort. So before I continue, I want to go through a quick update on the Target US trial, which is currently ongoing. So Target US is a multi-site, single-arm registry trial that has multiple sites around the country, and we are the head site at UCSF. So currently there's 1,114 patients accrued to the registry, with 97 having been accrued at UCSF. 11 sites are still open to accrual, and 22 sites are continuing to collect follow-up data, and we have a goal to continue to collect that follow-up data, and we're inspired by the high follow-up rates of Target A. I want to continue with demographics for the cohort of 101 patients that we are looking at today. So the average age of our cohort was 62.57. There was no significant difference in mean age between the participants that had a local recurrence and those that didn't. And the cohort was predominantly white with representation from the other indicated races. The median follow-up for the cohort was 5 years, and all members of the cohort had at least 3 years of follow-up data. So there were a total of 6 recurrence instances reported within the cohort over the entirety of the follow-up. And the cumulative hazard risk estimate at 5 years was 2.45%. And this is similar to the previously reported Target A recurrence risk that we saw earlier today. All local recurrences included here occurred in the index quadrant of the ipsilateral breast. So now if we look at how these local recurrences compare based on clinical characteristics. So the mean tumor size at surgery was significantly larger in the group with local recurrence at 24 millimeters than in the group with no recurrence. The average there was 15.45 millimeters. And all recurrences occurred in HER2 negative tumors. There's no other significant correlation between any clinical characteristic and local recurrence. And these further characteristics that we looked at included tumor grade, cancer subtype, and lymph node status. We also looked at relevance to external beam radiation referral following IORT. So 24.75% of patients were referred to adjuvant EBRT within this cohort after receiving IORT. This is slightly higher than the about 20% reported for Target A, and is somewhat higher than the entirety of the Target US cohort, which, as was reported at last year's Target conference, the percentage that received a EBRT referral was 14.77%. 2 of the total 6 reported recurrences occurred in the IORT plus EBRT group, but there was no significant difference in the local recurrence risk between the group that received EBRT following IORT and the group that received IORT alone, and the log-rank p-value of that was 0.4797. So in conclusion, there's limited correlation between clinical characteristics and local recurrence risk, and this indicates that the accurate accrual of the appropriate population for treatment. The 5-year local recurrence cumulative hazard reported here supports the findings of the original randomized Target A trial, and our results support that for select patients, IRT is non-inferior to treating local early stage breast cancer. So future work for us includes continued follow-up, analysis of survival following IRT treatment, and analysis of complications. So thank you to Dr. Alvarado, Dr. Max Pulsara, Sonal Shah, and Andre Dempsey for help with this, as well as the Helen Diller our Family Comprehensive Cancer Center. And I appreciate the opportunity to talk with you all today.
The floor is open for any questions, just in case. I just had a quickie question. I didn't quite catch it. Because you had a higher local recurrence rate with the larger tumors, did it correlate in any way to your margin status on those?
So we haven't looked at margin status yet. We do have that data collected, and hopefully we'll analyze that in the future. Thank you.